Okay, good morning. It's 10 o'clock. This is the May 20th Anchorage Emergency Operations Center operational update. I am Adam Collins, new planning section chief. Situation overview, go ahead.
Good morning. This is Luke Orrit, situation unit leader here in the EOC. Statewide, we're up 280 cases, 15 deaths, and 12 hospitalizations. And locally, up 89 cases, 2 deaths, and 2 hospitalizations. Next slide, please. For 213 resource requests, we filled or otherwise satisfied 1,753, with 17 currently working. Next slide. In the congregate shelters, we have 401 clients. That's down 7 since the last report. In the non-congregate shelters, 325 clients, up 4. That's 726 clients in all shelters, down 3, averaging 2,178 meals served per day. Next slide. Yesterday at the Visit Healthcare testing sites, there are 539 sample collections performed. And yesterday at all active pods, there are 223 doses administered. End report.
Weather, go ahead and give an update.
Hello, this is Joe here with the National Weather Service. Today, we've got sprinkles, very, very light rain for the rest of today. The next 2 days, we'll have some showers around, off and on, mostly off, mostly in the afternoon as well, with temperatures holding in the 50s. And then come Sunday and Monday, we'll clear out the skies nicely and warm our temperatures up through the 60s. And that's all I have.
Thank you, Weather. Operations, go ahead.
Good morning, everybody. This is Pat Ryder, Deputy Operations Section Chief. Today with Mass Care, our Q&I location has 6 projected discharges through Saturday. That's to include 1 discharge today. And our Q&I location has 6 vaccinated clients. Public Health, Visit Healthcare testing had a decrease of 19.79% over the previous week's sample collections. As of May 18th, our 7-day rolling positivity rate average is 1.18%. Our 14-day average reproductive rate is 0.815. And our 14-day average case rate, 7.34 for every 100,000 people. Our current alert level is intermediate. Our Elmore testing site hours have changed. They're now 10 a.m. to 6 p.m. And testing is now available on Sundays at the Lusac Library. That's from 10 a.m. to 4 p.m. Medical countermeasures. Visit Healthcare is now offering multiple vaccine types at all 5 of our vaccine clinics. We are currently reaching out to youth organizations, summer camps, and sports leagues to offer convenient mobile clinics for those 12 and above. This weekend we have an event. Alyeska Resort in Girdwood is hosting a vaccine clinic on Sunday from 9 a.m. to 2 p.m. And there'll be free lift tickets for anyone receiving a vaccine. And finally, just an important reminder, mobile vaccine clinics can come to wherever you are, be it a business, church, or other organization. To schedule, please dial 907-531-5100. This concludes operations. Barring any questions, end of report.
Thank you, Operations. Logistics.
Hello, team. It's Scott Carpenter over in the logistics section at the EOC. Here's our continuing lines of support. Nothing significant to report out on today other than to welcome Wendy Reese, who will be our new logistics and contracting lead. So welcome, Wendy. Pending any questions, end of report.
Thank you, Logistics. Finance.
Good morning. This is Carrie Whitaker, the current EOC Finance Section Chief. Currently, the EOC has encumbered $20,411,363. Our actual spent to date is $51,430,834. Our total is $71,842,198. Please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. For information about this, please contact Erin Zachary. Today, Finance would also like to welcome back to the fold Audrey Jo Malone, who will be taking over as Finance Chief beginning next week. So we're happy to welcome her back. End of report.
Thank you, Finance. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. At some point in our lives, we've all experienced stress, and or fatigue, whether it be work related, society related, home life related, or all of the above. And we experience it differently. However, the stress is responsible for and can lead to emotional exhaustion, which puts us at risk for total burnout. Sorry. So there's 5 stages of burnout. First, it starts at the honeymoon phase where we undertake a new task. We often start by experiencing the commitment to it, energy and creativity, and we feel really good about it. Then we enter the second stage, which is onset of stress. In this stage, we begin to have an awareness that some days are more difficult and we're not as optimistic as we once were when we first started. Then we enter the third stage of chronic stress. This is marked by changes of your stress level and going from motivation to experiencing stress on an incredibly frequent basis. You might experience more intense symptoms in those stages of lack of apathy, anger, aggressive behavior, and chronic exhaustion. And the fourth stage of burnout, it's where symptoms become critical. Continuing as normal is often not possible in this state, and it becomes increasingly difficult to cope. Then we enter the 5th stage of burnout, which is habitual burnout. This means the symptoms of burnout are so embedded in your life that you're likely to experience a significant ongoing mental, physical, or emotional problem. So we need to prevent that before it happens. In the study, it shows that everybody does experience it, but it usually happens around the age of 32 in a career in a high-powered field. So with all of us doing the COVID work for the last year with our other jobs as well, we are at a high risk for this. So just know the warning signs, take care of yourself, eat right, exercise frequently, and take frequent breaks and ask for help when needed to take care of yourselves and report.
Thank you, Safety. Public information.
Good morning. This is Public Information Officer Heather Arono. Just want to let you know about some of the things that we've been working on. Coming up on Memorial Day, we will be coordinating with Mao Tosi and the Anchorage Corvette Association to have a combination car show and vaccination clinic. This will be at Northway Mall from noon to 4 p.m. on May 31st. It should be a lot of fun. There's going to be a dance troupe there, food, and if anybody's been looking for an excuse to go look at some cars and get your vaccination, this is the perfect opportunity. Also want to let you know that we are working with the mayor's office and coordinating with Beans Cafe as well on a new Humans of Anchorage profile series. The first of these profiles was posted on the acting mayor's Facebook page yesterday. Encourage folks to go take a look at it, and just a way to highlight some of the folks that are part of the population experiencing homelessness in Anchorage and help tell their stories. So we are looking for more candidates for this profile series. So if you have any ideas for folks we should reach out to, please let us know. We're continuing our outreach to local businesses about hosting pop-up clinics as part of our Sleeves for Summer event, or Sleeves Up for Summer. And of course, reaching out to the community about testing and vaccine appointments, and just making sure that our community leaders are looped in on new updates. Barring questions, that's the end of my report.
Thank you, Public Information. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all of our partners who are able to join us today. I know we have a few on that would like to report out, so I'll first open it up to Tracy with the Mat-Su Borough EOC.
Hello, we are continuing to assist Alaska Public Health Nursing in the Mat-Su with vaccination clinics. Tomorrow we'll have a booth at Friday Flings, which is the Palmer Farmers Market. And Saturday and Sunday, there will be a vaccination booth at the Palmer Gun Show at the MTA Event Center right next to Palmer Junior Middle School, with a drawing for a gun safe. There's an entrance fee for the gun show. And thank you very much. End of report.
Thank you, Tracy. And next, Ashley Lally with the Anchorage School District.
Good morning. This is Ashley with ASD. I just wanted to come on and say thank you to everyone. We've made it to the last day of school with students in the building. Over the last 6 months, we had just over 60 classroom closures. We had 1 full school closure for 1 week. And moving forward, we are going to have 2 summer school cohorts. The first one starts in June, and the second one starts in July, and we'll have those at over 30 locations. We're also going to have 24 vaccination clinics starting this Saturday at the Ed Center and going through September. Those vaccination clinics will be available to anyone in the public. In addition to those, we're also going to do more targeted vaccinations at the summer school sites. And those vaccination clinics will be for students, staff, and families. Other than that, we are starting school in August on the 17th. So thank you again. That's it for me.
Thank you so much. I hope you get to enjoy some time off now that school's out. All right, do we have any other cooperators who would like to report out today? All right, hearing none, we'll go right into the hospital report outs. And we'll start with Alaska Native Medical Center. Was Kirsten able to join us?
Good morning, this is Kirsten at ANMC. Today we have one positive inpatient. They're not in the CCU or on a ventilator, and 0 PUIs. End of report.
That's great news. Thank you. And Alaska Regional Hospital, Sean, I believe you're on.
I am. Alaska Regional Hospital currently has 4 COVID positive patients, 1 ICU. That person is on a vent, and we have 1 PUI.
Great. It's good to hear these numbers are dropping. And is Nikki on for Providence Alaska Medical Center?
Yes, I am. Good morning. Today we have 6 COVID positive, 2 in ICU, 0 on mechanical ventilation, and 1 COVID recovered. Thank you.
Thank you, Nikki. And Kara with Matsu Regional Medical Center.
Good morning, it's Kara Cahill, Matsu Regional. We actually did have a little change in those numbers. So we're still at 3 total positives, but 1 of those is in the ICU. None on vents and 1 PUI.
Great. Thank you, Kara. Still, that's good to hear the dropping of numbers out in Matsu as well. And was anyone from the 673rd Medical Group able to join us today?
Yes, ma'am. Good morning. This is Sergeant Perez with the 673rd Medical Group. Reporting our vaccine numbers. As of yesterday, we have administered a total of 17,836 vaccines, 9,570 of those being the first dose, and 8,266 being both doses. Again, I'll put these in the chat, pending any questions and report.
Thank you so much, Sergeant Perez. And that's all for liaison. Thank you.
Thank you, ma'am. Incident Command.
Good morning, everybody out there. This is Amanda Loach here for the command. Thank you all for being here and your continued diligence working together with us. At the municipality of Anchorage, our team here is looking forward to the next phase of managing this disaster with the new normal of our disaster-specific response and recovery teams embedded in departments. We will be moving from a command incident management team to a coordinating structure next week. Should be seamless to all of you as we continue forward with our operation. At the Department of Development Services, our mass care team is transitioned over there and will be conducting operations at Development Services. And at the Anchorage Health Department, we will have our testing and vaccine teams. And then at the Office of Emergency Management, we have our COVID-specific Emergency Operations Center support team continuing to conduct situational awareness for all of you and for us, and then filling out the resource requesting process and continuing forward with recovery. Please continue to reach out to us early and often and ensure continuing optimal coordination for us. Beyond that, today's the last day of school. Again, we really appreciate all of you working together through this year. We do have adjustments to our operation to support the individuals and families in the jurisdiction, getting through the summer safely with as many people getting vaccinated along the way as possible. Have a great weekend. See you guys next week.